Hello, welcome back to A Slightly Twisted Female. I'm your host, Brittany Rue. I am really excited to have my guest here today, Buck Angel, who I'm sure many of you recognize, whether whichever side you're on, has been, just a really big figure in this just moment in culture and in time. And so this is why I really wanted to take a time to talk and kind of go through. We represent different groups. I mean, different sort of perspectives, and I think that there may be some overlap and there may be some points of contention, and hopefully we can work that out. So welcome, Buck. Thank you for joining me.
Oh, that's sweet. Thanks so much. I really do appreciate you having me on. I know we probably do have different opinions, but I'm cool with that. And I just really I want to appreciate the fact that you're wanting to at least kind of have a conversation. I don't know if building a bridge, but at least you have me here. And and it's not something everyone's willing to do, as you know, on both
Right.
sides. So I do appreciate now that we're going to have this excellent, respectful conversation with each other. Hopefully, maybe break some barriers here.
Yeah, let's see where it goes. Hey chat, hey everybody. We got 57 people.
Excellent.
Welcome everybody.
Excellent.
Hopefully we'll continue to see that grow. And so I guess, I just want to start by just kind of hearing from you just some different things. So, I have criticized you in the past in regards to, we talk a lot about true trans. I've held several spaces about it. I had a debate with Laura Hobbs. I've had a lot of conversations with different people, and I wanted to sort of get your perspective on, we talk a lot about this sort of idea of a true transsexual, gender dysphoria versus this newer iteration of transgenderism, which kind of comes from a lot of the academic queer theory and more Marxist ideas. So maybe if you could just clarify for us what you say that you're what was the term you said, something but not woke, trans but not woke, or something like that.
I'm
Tell us
not
a little bit
woke.
about, tell us about like what that means.
Well, what I mean by that is I live in reality, and so woke to me is not necessarily reality. And I'm also I would say I consider myself a liberal, and I used to be sort of more on that side, but I would say now I'm kind of very nuanced middle ground space. And so with that's my politics, right? I don't necessarily politics is a whole other kind of thing, but I'm most definitely more middle ground, I think, at this point. And so I want to first off just let you know that I'm a transsexual person. And so when you talk about true trans, I talk about transsexual people, which is what I am. And there's a difference between what I am and what this generation calling themselves transgender, which is an umbrella term, right? That encompasses basically anyone,
Right.
basically anyone who wants to be trans or gender variant or an animal or whatever else is going on over there. I have what I call a medical condition, which is called gender dysphoria. And I have been diagnosed with that 30 years ago.
Mhm.
And I took the medical steps that transsexual people take to make myself look like a man so that I can live my life looking like a man. I did not change my biology. I did not change my sex. I changed my appearance. This is what a transsexual. We're very knowledgeable on that. We admit that we are biological male and female. We walk the world in a space that we want to sort of coexist with you, if that makes sense. I don't want anybody to know I'm trans. I want people to see me as a man and just kind of put myself into that space, all knowing all along that it is up to me, not up to you, to make myself not only comfortable, but to also make you comfortable. That's always been the transsexual way. We've never wanted to make you feel uncomfortable. We've always wanted to sort of blend in with you. And now I see a newer generation of people punching you in the face.
Right.
And that is where I'm like, okay, nope, I have to start to speak up. And I'll
Right.
be honest, it's not easy to sort of speak against your own community. But I realize now that that's not my community anymore. That is, I have no values there. There's nothing that I'm attached to in that community. I'm a community, I think, of love and reality and, just basically existing in the world.
So I guess if I could ask you to give a sort of a concise definition
Mhm.
of a transsexual versus transgender? I know you just
Yeah.
described it a little bit, but if you
Yeah.
had to if the dictionary called you up and was like, we need you
Yeah.
to give us the most concise definition of both these terms, what
Great.
would you say?
I would say one is a medical condition. So I have a mental disorder, right? I'm in the mental health space. I have a mental disorder. It's a medical thing. It's called transsexualism. Transgender is a self-ID space that has nothing to do with medicalization and everything to do with wanting to take on an identity. So they identify as trans. I don't identify as trans. I identify as a male. You see the difference?
Right.
So I want to actually be a man, though all reality, I know I'm not. They don't want to. They want to be trans. Like, that just doesn't make sense. We've always never wanted to be we're not trans. We don't, this isn't an identity. It's a medical condition. So that's why I'm like, I'm hardline. No. I don't know what you people are doing over there. You can't self-ID as trans. You have to sort of go through a system to make sure what you have is really that situation that you need to transition over to.
And what would you say is the sort of criteria? I know that there's been a lot of changes to the DSM. There's a lot of influence with the World Protocol of
the WPATH, the World Psyche.
WPATH.
Yep, totally.
World's, what is it? What's the P stand for?
The World's Psychological Association of Transgender Health. By the way, it's a joke. I do not support them. They're self-appointed. It's an organization full of hypocrites and scammers and grifters, and everything that comes out of there is a complete total lie. By the way, it used to never be that way. It also got captured.
Yeah. So Genevieve Gluck, I don't know if you're aware of her. I always say that she's probably like my biggest shiro in this movement. I'll shout her out, as often as I can. She's the founder of RouXX, the co-founder with Anna Slatz. She's an investigative journalist, a feminist investigative journalist. I think she's done amazing work to really put this conversation on the map. And one of, I think, the most profound contributions she's had to this conversation was exposing WPATH and the people therein who have some major influence with WPATH is being fetishist, involved with, things like the eunuch archives, which has pedophilic, either straight up pedophilic, just membership or sympathies. There's a whole archive. There's a whole section where people can submit their own sort of fantasy short stories. A lot of these things involve fantasies involving young children, as young as infants, as well as animals. And, members of this organization are high-ranking officials in WPATH. And what concerns me is that WPATH has a massive influence on the diagnostic criteria manual, which we use to diagnose things that, I guess, previously it was transsexualism, and then it was gender or identity disorder. And now it's become gender dysphoria. It seems like the goalposts are constantly changing. So I guess my question to you is, because of the obviously the well is tainted when it comes to things like the diagnostic manuals that professionals use, like the DSM, and these sort of conflicts of interest. It's sort of like you're having, especially the fact that we're having a lot of trans identifying people who are helping to write the sort of protocols and criteria. It's almost like asking an active drug addict to sort of define what is, the laws around being, on drugs and peddling drugs and things like that, so what. And my also concern is, especially, in Canada, for example, and in the US, where we have an affirmation only model, where these sort of, anti-conversion therapy laws that are on the books in Canada. And I know that they're trying to push for that in certain parts of the United States, where medical professionals have no other option other than to positively affirm the claimed gender identity of anybody who comes through their doors. So what then would you say should be the criteria And my concern with you saying that, you know, and I know Buck Angel, I've talked to Ariel Scarcella, I was
Right.
on her
Yeah.
Rumble channel.
Right.
I've talked to, you know, people like Holly, is this other guy on Twitter who I just got in a big fight with.
Well, it's easy to do that on Twitter, just so you know.
Yeah, it's a shit show.
Totally.
But my, you know, my thing to them was, if, you know, and I came into a space where it was a bunch of people who consider themselves like, you know, true transsexuals who sort of follow the model that you and Blair
Yeah.
have sort of, you know, Marcus have sort of
Yeah.
set forth. And my concern with that is, if the idea is that to be truly trans is that you need a diagnosis,
Right.
yet the people who are doing the diagnosing are following, you know, using a manual that
That's
is
right.
obviously poisoned,
That's
and
right.
then if they have no choice but to affirm, how can that be the criteria for
That's right.
transsexualism?
No, I mean, I'm telling you, I agree with you. I 100% agree with you. And the reason I agree with you is because I come from a space where we used to have, they call it gatekeeping, which I particularly don't use because they've made a negative, which is not a negative thing. To gatekeep anything is not negative. But
Right.
that being said, I call it safekeeping. So I come from a space where we had safekeeping, where I had to go through years of mental health care. We never transitioned children back in the day. That was not even a thing anyone ever. The whole point was to try to get me out of dysphoria, not
Right.
into the dysphoria. It's why you had a long length of time where you sort of socially transitioned and walked the world looking like a boy and trying the clothes on, right? But again, I was 30 years old. And so we would never talk to a child the way we are today. Number one. So we had rules and regulations in place. What was specifically for adults. And what we did is we put you through a system, right? A system that said, okay, let's see what's going on with you. Let's push back. That's why I disagree with affirmation therapy. That is the most insane thing I've ever heard in my life. That's not therapy. Therapy is to go in and try to vomit everything out, get rid of it, and hopefully not have to take the medicalized road. You know, I wasn't pushed into this. It took me years to figure this out and to finally say, yes, I'm going to do this. But through a system of slowly making sure this is what, and 30 years ago, I did this, my friend, and I have never looked back, and I've been totally solid. Today, what you said is exactly what we're trying to fight against. Blair, me, Marcus, excuse me, the true trans, whatever you want to call us. We're fighting against everything that you're saying, because everything that's been rewritten, right? The manual's been written. It's been taken out of the DSM-5. How dare they do that? I have a mental disorder. It is extremely important that that diagnosis stays with me, because not only does it help me understand what's wrong with me, but number two, and helps me medicalize in a safe space that says I'm under a control of a doctor and I'm getting my today. You're not even under the control of a doctor. A 16-year-old can go on the internet and say I'm trans in 15 minutes. You know that. I don't need to even tell you that. It's disgusting. And that's why we're trying to say, hold up here. You people are so insane. You can't transition children. You should be getting them out of dysphoria. When you tell a child they're trans at 10, you've now immediately put them into a space that they should never, ever be in. You should be helping them say, hey, wait a minute, it's okay to be, you know, this way or that way, or to dress like a boy and you're a girl. And we're regressing. And so many, I don't want somebody to transition that doesn't need it, by the way. That is not why I'm here. I'm not here to sort of bring people on. Where I feel the new generation wants to, on some level, indoctrinate and bring people on to be trans. I want only someone who's trans to be making sure they're making that safe leap into irreversible, hear me, irreversible surgeries, irreversible hormonal usage. I can never go back to looking like you. And I know that. I'm very aware of it. And I've done everything as an adult and focused on it as an adult.
So, yeah, no, and I appreciate that. And I think that, you know, I think we can all agree that transitioning of children is horrific. It's cruel.
It's cruel.
It's evil.
That's right.
You know, and I feel like, and I've talked about this before, I feel like, you know, while I don't identify as trans and I don't, you know, have gender dysphoria, and I know that there's a lot of controversy about the merits of gender dysphoria, you know, but I do feel like I have some relationship to what some, especially trans identifying females go through. In 2021, I was diagnosed with squamous cell carcinoma.
Oh, no, I'm sorry.
Yeah, no, thanks. I'm okay now. I'm like no evidence of disease, but I needed
Yeah.
pelvic radiation. And I had, 25
Right.
rounds of pelvic radiation,
Wow.
like, 70 gray or something, which is a really high dosage. I
Yeah.
had something called an ovarian transpositioning surgery, which was, laparoscopically, they went in, and I actually had to advocate this for myself because
Wow.
even my oncologists, and I think a lot of this has to do with the fact that 20 years ago, the sort of cancer diagnosis that I had was a death sentence. It was
Hmm.
something like you had like a like 15% or lower chance of
Wow.
survival, 5-year survival. They made some changes in their protocol, and I mean drastically increased the rate of survival. And also, they
Wow.
had originally diagnosed me as stage 3. It was actually stage 2.
Oh,
Um,
wow.
but I say that to say I had to really push. I did my own research, and I had to
Mm,
push to have this ovarian transpositioning surgery
mm,
to get my ovaries out of the field of radiation, and which turned out to be a futile but attempt to save my ovarian functioning.
wow.
Because I knew the horrors of premature menopause. I
That's
was
right.
33 years old at the time. I was terrified. The more that I read about
Mm,
premature menopause, we know that, for females, our synaptic firing in our brain
mhm.
is dependent on the presence of estrogen.
That's right.
I heard you talk about things like vaginal atrophy,
Yep.
and eventually going septic with the fusing of
Yep.
your cervix to your uterus, and
Yep.
I guess the hardening of your vaginal walls, which is horrific. And I was
Horrific.
scared of something very similar.
Mhm.
I say that, so I do feel like I personally have had, I feel such a personal stake in
Mhm.
warning people about this.
That's right.
I know that my doctors didn't really care or understand about what menopause does to women.
That's right.
Um, they weren't gender medicine doctors. They didn't care. They
No.
didn't know. They didn't have much to tell me. I was actually educating them, and I just was like doing stuff from
Wow.
Google and learning stuff from Google.
Yeah.
So I do think it's, if we're throwing young children in early iatrogenic menopause for cosmetic reasons, I think is heinous.
Heinous is like an understatement.
Right.
It's insane. Are you I can't even believe we're even having this conversation. I can't even believe it. I can't even believe that we would ever tell a child they can change their sex, because I never changed my sex. I'm still a
Right.
biological female. You know that. I'm very attached to that. I speak about it all the time. It's important that I stay attached to it for my own health reasons. But not only that, no child can ever make the choice of what I did. Sterilization comes from that, right?
Right.
All kinds of millions of long-term effects are going to come from these kids that we're trying to, and all we're doing is changing their outside, right? You have to understand this is a mental
Right.
disorder. It's a mental disorder. Why are they not starting with mental health care? Why are they
Right.
starting with physical health care? That's where I'm like, this, you guys are all backwards.
Right.
You're throwing
So
these kids into a car wreck. That's what they're doing.
right. Right. And then, and just to, I know that I think one of the things that, we had just talked about this prior, that you and Isaac had gotten into, and I
Yeah.
think Karen Davis, who's actually here, who,
Okay.
I consider, a colleague of mine,
Cool. Cool.
uh, yeah, who I think is great, and I know that you guys had gone back and forth.
Come on. It's the internet. Look, like I
Yeah,
said, when I started here, of course, I'm going to have people who dislike me here. Of course, I'm sure they're saying all kinds of things. That's okay. I'm not
right,
here for that. I'm here to have the conversation with you. Everyone can have their own opinion about me. It's not, it's not going to make or break me. I'm not going to go away. But
yeah,
that being said, I'm here to have a conversation with you, and people can throw all kinds of stuff at me. You know that, friend. They do
right,
it all day long. You don't think you don't think the trans community hates me? They
right,
hate me. My own people, right? Hate me. So I'm here because I know I'm willing to take the jabs. You know
yeah,
that, because I care about kids. I'm only
right,
here for the kids. Just so everybody knows, An adult can do whatever they want. You're never going to stop adults from transitioning ever.
Right.
You're not going to do that. That should
Right.
not be your end goal here. Your end goal should be that we need to focus on kids. And I'm an ally with you, by the way. I do not believe children should ever be in a space to transition, nor do I believe that we can literally tell children that they can change their sex. This is
Right.
all bullshit, all of it. And I'm here to tell you that. That's why you can disagree with what I did. That's perfectly okay. I have no issues with that. What I have issues with is me and you have to come together for the children.
Right.
Period. And if I have 30 years experience as a transsexual, they're listening to me, by the way, because I'm a person of lived experience. So I can step up to the plate and talk to the senators and talk, which I'm doing, talking to everybody saying, hey, hold on here. I'm one of the most oldest transsexuals on the planet right now. You have to listen. And it's girls who are transitioning, not boys. It's girls like me.
Right.
So these trans women who are biological males, as we all know, are speaking over me for young girls. Get out of my way.
Right.
Sit down. You don't get
which I think is important to, it's interesting because it's like, even after transition, we still, in so many ways, sort of, it seems like people retain in a lot of ways the space as being, male or female, like under, patriarchy.
That's right.
And I guess, just to challenge you a little bit.
Right on.
That's okay. I did want to ask you about, some statements that you had made earlier, and if you were, willing, like, to just sort of talk about them sort of in context, and just so I'm not paraphrasing you, because I don't like doing that. I don't think that that's helpful.
Okay. Yeah.
I just wanted to bring up one now. This is from my loveliest Karen, but she did have a clip that I did want to challenge and ask you.
Okay, cool. Right on.
Yeah.
I do have a concern.
Let's see.
It's a little give or take. Here we go. Without further ado.
I do have a concern with youngsters, and that could be anywhere from the age of 10 to possibly 14, maybe even lower than that, 10 and below. I have a kid that I work with here in Los Angeles who's 8 years old on hormone blockers. That's right. And he's doing great. Everything is awesome. I see him taking the next level. He went through a large amount of mental health care. He went through a system. Parents I talked.
Did you hear that?
Did
you hear this one?
Yeah. I thought that was you. No, I 100% said that. And I'm very open to the fact that I used to be pro puberty blockers. I used to be pro transitioning children because I did meet a kid here. And I've since retracted that, by the way. You are allowed to change your mind, people. That is actually very important, that you let people change their mind. Because if you do not let people change their mind, you're not going to get anywhere, and I'm not going to get anywhere. I'm allowed to change my mind because at that time, I was being indoctrinated into the thought process by the Children's Hospital here in Los Angeles with that 8-year-old kid that I was literally next to watching the whole thing happen. And I was like, wow, this is incredible. I can't believe we can do this. Until people like you were like, fuck, throwing me all kinds of stuff. I'm like, hold up, I got to read this. And that's when I was like, oh, I see what's happening. So you've got to give me, well, I'm just being honest here. I said it, 100% I said it. I believed it. I was for it, and I have since changed my mind and have said that that was wrong. I should have never said that.
So do you apologize?
100%, constantly. Why do you think I'm on the front lines? I'm on the front lines of making sure these kids don't take those puberty blockers for that reason, because I'm part of that.
Good. Yeah. Have you followed up with any of these kids? Do you have any knowledge of
one kid, only one. Yes, I do.
Yeah.
I'm in very constant contact with the mother. In fact, I just talked to her last week. Yep, totally. I'm watching everything that's happening for many reasons. First off, because I don't want the kid to grow up to be a complete mess. But secondly, I want to see what's going to happen with this kid.
How many, can I ask how many years ago that was?
That was, gosh, it has to be I think the kid is 16 now.
Okay.
So 8 years ago.
So have they started
high school? They're in high school. They're doing great.
They started on the cross-sex hormones yet?
Yes.
So the child's been sterilized at this point.
Oh, totally. No doubt. You would never know that, he or she, whatever you want to call, she is now he. You would never know that they were ever a girl, ever. Yeah. But we know There are definite long-term. And the mom talks to me constantly. I'm scared, Buck. I don't know. I said, I know. I'm sorry. But that Dr. Olson at the Los Angeles Children's Hospital. That's right. She's the one who just throws these hormones at kids like it's candy with no evaluations.
What was the hospital?
Dr. Olson, and it's the Los Angeles Children's Hospital. Look into it. They're the ones who are really pushing the puberty blockers.
Okay. Yeah. I just think it's real. So I just had a couple days ago as a Joanne, it's a woman, Joanna. Yeah, here we go. This is it. I do think it's important to, expose these people. And I mean, especially because, at the end of the day, I think you've acknowledged that you have mental illness and you have, so I think to take a, mentally ill woman or a woman who's
has a
history of very severe psychiatric conditions, and then, use these adults to sort of promote, medicalization, it's really horrific. And I just had somebody come on the channel a couple of days ago who, while he was homeless, was sort of taken in by an LGBTQ sort of like, I guess, homeless. This was in LA. This was in LA or no, San Francisco, which is, I mean, like the hotbed of it.
Totally.
Took him in and offered him, room, board, and basically transition care. And he ended up getting full bottom surgery and, almost immediately realized it was a grave mistake.
That's right.
So, you're talking about gatekeep. Well, here, real quick, let's just put this person on blast because I do think it's fucking important. And this is me doing it. This isn't Buck. So
I'm a guest. This is your show. It's not my show.
But it's like, if these people want to have anything to say about it, they can.
That's the thing is, the trans community tries to hold people accountable constantly. I'm like, you better watch yourself. Now people are going to start holding you accountable, my friends. It's not a one-way street, by the way. I don't support the trans narrative. I don't support. There she is. That's her.
So,
anyone who knows anything about what's happening with kids knows her agenda. She started doing this earlier before a lot of other people did. She really pushes it on the young people. She's the one who said, if you decide that you want to change your mind after you get top surgery, you can just get fake boobs put on. She's the one who said that to a 16-year-old kid. Right. Can you imagine? No, you can't just put boobs on.
And to be clear to anybody who's watching, who hasn't watched me before, or who doesn't have as much experience in this topic, puberty blockers, which they say are reversible, they absolutely aren't. They prevent bone mineralization. They prevent, our brain development, our neurological development depends on our sex hormones. Our endocrinology is in such intricate balance with our, physiological and anatomical development, though that time that is like missed and passed. And also, how could anybody possibly say that when we don't have any long-term studies, when this is all happening right now? This is ground zero.
Disgusting. And every country in the world stopped doing it except us.
Right.
You know that. You know that. And, you know your stuff. I can tell. Yeah.
And Lupron, which is a men's cancer drug. Again, we're giving cancer treatments. Double mastectomy is a cancer treatment. That is an intervention for women with breast cancer. Okay, prostate cancer. Lupron was developed to inhibit the testosterone and the sort of endocrinological functioning of men who have, androgen positive cancers, that, having more androgens in their system will advance the cancer. And we're giving this to children. And I want everybody to know that, hormone blockers followed by cross-sex hormones results in sterility 100% of the time.
That's right. Yep.
And especially for young males who are taking that and then want to go on and get these penile inversions surgeries. We've seen the horror of Jazz Jennings under Marcy Bowers. And Marcy Bowers, who is a part of WPATH, who was the lead surgeon for Jazz Jennings, has acknowledged that any child given puberty blockers followed by cross-sex hormones prior to Tanner stage 2, in his estimate, there has never been any patient that will ever experience an orgasm after that. Ever.
How can we make that choice for a child who's going to be an adult? That's what I keep saying. No, I also want to let you know that it's the parents are being manipulated. We all know that. I hope you know that. The parents are being manipulated. They feel lost. I talk to parents all the time and give them lots of great, because they don't even know where to find resources, how to get their kid out of it, right? Because there's
Who do
only
you refer
resources.
to? Like
So
when
Gen Spec, do you know Gen Spec? They're
okay.
amazing. You should connect with them. You know, they will give you some great information.
My
Also,
problem with Gen Spect
uh,
is I don't know if you watched Affirmation Nation,
yeah, I
which
did.
was
Yes, I
great.
did.
And I
Yep,
was, had Joey Bright
yep,
and all,
yep.
it was great, great, great until all of a sudden you have Ayana Assad, or I think that's her name,
Mhm.
is sitting there and saying, for every one child that medical transition helps, 100 children are harmed. And I was like, whoa, hold on.
Yeah,
Hold
see,
on.
again, it's going to be hard to find these really hardline people. So that's why I'm trying to find organizations that are willing to have these conversations. And it's so difficult because parents are lost. There's new books that are coming out by, I think it's Sasha. Is it Sasha Ayed? And
Partners for Ethical Care is a good alternative to Gen Spec.
also Geta, Geta, the therapy. It's GETA. I think it means gender therapy, exploratory therapy. So they're trying to stop affirmation therapy. We're all trying to stop affirmation therapy.
Right.
That's not therapy. That's actual indoctrination. That's actual conversion therapy. They keep calling they keep calling non-affirmation therapy conversion. I'm like, what? Wait a minute. Conversion therapy is when you're talking someone into what they're not, which is what you're doing when you affirm a kid who says I'm trans. That's literally the it's you see how they manipulate us
So
in our
my
thought?
biggest concern is, and it's and again, and I've discussed like, you and Blair and Marcus and some of these other, I guess the transsexual community, I guess, my criticism has been that when you hear somebody like Ayana Assad, I think that's how you say her name.
Okay.
Ayana Assad, who's part of Gen Spect. When you hear somebody and you're a parent or
Yes.
you're a youth and you are fully in this and you really, again, and you're in a state of whether it's delusion or mental illness or just, and also obsessive compulsive. I know Richie has talked about, his transition being sort of a byproduct of obsessive compulsive thinking. When you're in that and you sit there and you hear for every one child that it helps, there's 100 children that it doesn't. My thought is most people are going to be, oh, well, I'm that one child.
That's right.
I mean,
That's right.
everybody else, I understand that it's probably not right for them, but I'm the special, exemption. I'm the one. And, even in terms of like with adults and stuff, how many, I don't think that a lot of people are going to be willing to step back and be like, well, yeah, I'm the one who's kind of bullshitting.
It's happening though. That the problem is it's happening too late. So that's what we're calling detransitioners, right? It's happening too late. We're not catching this right. And then what I said from the beginning, we're supposed to try to get these kids out of what we call dysphoria, right? And I think a majority of these kids don't have dysphoria. They have totally other things going on. That's why I'm so anti everything that's happening. We're not doing mental health care with these kids. You can't affirm a kid who says that they're an animal. That's unbelievable to me. That's going it's going backwards and where we have progressed to. Number one. Number two, this is a mental disorder. I'll keep saying it over and over and over again. And if we don't attach ourselves to mental health and try to get these kids to move forward without having to transition, which many of them can, that they grow out of it. We all know that. Yeah, that's a reality of it. And so we're not doing that. We're actually as far as I'm concerned, putting these kids into a dysphoric state. And like I said again, I do not think there's anything such as trans kids. I do not believe that. That is not true. These kids are dealing with all kinds of. I interview tons of people on my channel, right? And I interviewed a mom right now whose child died.
Yeah, talk about that a little bit.
Yeah, it's horrifying.
Yesterday.
I mean, I literally can't even I mean, it's horrifying. So this mom is amazing, but her child, she thought, and the child thought they were trans, dealing with literally had like 5 mental health diagnoses, right? That kid should never be transitioning, BPD, whatever, anxiety, OCD, like all this stuff going on with this kid. And she walks into Planned Parenthood and in 15 minutes gets a testosterone prescription, the mom said. Anyway, eventually the kid had a drug problem and OD'd and died. And she went into her room and there was a massive amounts of testosterone that she had hoarded in her room. So what's going on, people? No one should ever have access to testosterone like that. Number one. Number
I think
two,
there's a huge correlation between like addict behavior and
totally,
and
totally.
you
Yep.
know.
I agree. I'm a recovering addict. So 30 years of recovery.
Yeah.
But I did all of that when I was a kid, right? I did all kinds of drug addiction, homelessness, all kinds of insanity that I got out of. But
Right.
today I'm totally focused. And so I know people don't believe in transsexualism. I can hear you all. I know it. But I'm trying to just to let you know that whether or not you believe in it, an adult like myself has made that choice. And I do live, but I also don't believe children can do this. And that's the sort of nuanced space I'm trying to find with you, is that there is no child out there who is trans. They are dealing with something. Could be dysphoria, it could be a lot of things, but we should really try to get that kid into a space of not transitioning.
What is the consequences of adults not having access to transition?
Well, I think that that's dangerous in a sense that many bad things could happen. Alcohol abuse, drug abuse, trying to cut your own body parts off, which many of us did back in the day. I mean, I come from a space where there was no internet. There was no access. I didn't have access to the internet when I transitioned. Thank God I didn't. I had to find everything sort of in a very kind of a Wild West way. But that being said, people back in the day would cut their own body parts off and do nasty things to themselves and hate themselves. And so that's why I'm telling you that we can't take it away from adults if an adult can make a choice to have an abortion or, get a boob job or drink alcohol or slam drugs, and that's a legal space, we have to also let an adult make a choice.
I mean, but heroin and stuff is not legal.
No, it's not, but it's still accessible to people, right? But also we could use any other things that are legal. What I'm trying to say to you is that this did help me, and it did help Blair, and it did help Marcus, and that's what we want you to see.
So my question, So my question is, right? If you're saying that the consequence of an adult not having access to, these drugs and surgeries allocated to them by, medical establishment, whatever, it's still, my concern is the narrative is still that there's just no other path, and then it'll turn into, I guess, suicide rate, self-harm, those sort of things, drug abuse. So I'm just wondering, how do you reconcile taking that position when it comes to adults versus we have a mother who is dealing with a daughter who, and I don't know if you agree with Lisa Lippman's rapid onset gender dysphoria
I do.
theory.
Yeah.
But, again, it's sort of like, if how can we say that children, if you're saying that, like, for adults who they'll go and kill themselves, and that's always been the narrative for why children should have access to it, then isn't that sort of like contradictory?
No, it's not, because I'll tell you why. And I hear what you're saying, friend. First off, I didn't say suicide. I said it could be kinds of things, and that could be one of them. Okay. It's not the main thing that's going to happen, because here I sit today. I didn't kill myself. But what I also want to let you know is that I lived 30 years of my life. What I'm trying to say is you have to let people find their path when they're adults. And you cannot stop an adult from doing it. You will never stop an adult from doing this. They'll find a way to do it that could be more dangerous, like we did 30, 40 years ago, right? They would get drugs from the street. Trans women would be shooting drugs from the street and actually using Crisco. They were using Crisco in order to create the curves in their body. These are the kind of, and then they would get septic and get sick, and all kinds of crazy poison would go into their body. They would use stuff that's called, that stuff that you use to inflate tires with, it's like an emergency tire thing. They would use that stuff in order to get hips and things because it wasn't accessible to trans people. So I want you to see the history of where we have come to today. I want to make it a safe space for adults, because you will never, ever stop an adult from doing this, no matter what. So that's what we have to really concentrate on.
But is that true? I mean, so are you saying that,
it is true.
transition is the only way to alleviate, these feelings of gender dysphoria?
For some people. For me, it was. I lived 30 years as a woman. I lived 30 years as a gay
And
woman.
you did say that you were fine. You didn't hate yourself as a woman, and you were okay as a
Oh,
woman.
no. I did not like myself as a woman. I don't know if I actually ever said that. I said I was not comfortable
I
living
was
as a
binge
woman.
watching you yesterday.
I am
I
not
was kind of
comfortable.
grabbing
Now I am. Now I am. Now I've connected to that person. I used to hate her. Now I actually love her, and she's part of my system. What I'm trying to say is, no, I was not comfortable living like you. I look, like you, and that wasn't comfortable for me to walk the world. This is comfortable. What I'm trying to say is, I don't disconnect from my biology. I know exactly who I am. I'm a biological female who looks like a man. It's real simple.
Why? And then why, and this is even like my question to Blair, for example, and I said this to Ariel Scarcella when I was on her Rumble channel. I always thought it was really interesting, and I've said this multiple times, but like, for example, Shapeshifter.
Yes.
Shapeshifter, who, again, somebody else I consider a colleague, who
I love her. She's awesome. Yeah.
Really, he does go by he, him.
I'm sorry. Yeah, you're right. I do that a lot because
And
I get confused.
right. And he acknowledges that he's a gay man. And I always thought that was really interesting about him was that, he still, it's not like he realized that he was a man, that, what he did to himself was harmful, and then felt that he had to, swing back to these other gender norms of cutting his hair and, wearing like lumberjack stuff, you know what I mean? And taking on these sort of traditional sort of like, male gender roles and presentation. I always thought it was powerful that he kept the long hair. He still does, makeup. He still wears, these beautiful clothes and outfits and things.
Awesome.
And I thought it was interesting that, for example, he and Blair White, who, Blair, I guess, had flown out Shape to do an interview. And I mean, his story is just like, heart-wrenching.
I know.
So you have these, two who are at one point, trans-identifying males, and one has his penis, one has gone all the way, has an inverted penis, so no longer has his testicles, who, is completely reliant on exogenous hormones, and they're both sitting together. Yet one acknowledges that they both, have, again, like beautiful hair, makeup, whatever, one acknowledges is that he's a man, uses he, him. One calls himself a trans woman and uses she, her. And it's like one has his penis, one doesn't. Guess which one is which, right? And it's just, to me, it's like, what would be wrong with Blair just expanding our understanding of what some men present like and look like, and just be like, I'm a man and this is what I look like, this is how I dress, and this is how some men dress. And my, my question to you would be the same, because I see a lot of butch lesbians, or not even just butch lesbians, because I know that there's even just butch bisexual and heterosexual women who take on a very masculine presentation. That's who wear things like sports bras and stuff, and who are pretty flat chested or whatever. And I mean, you would probably, like, maybe if you saw them, you would mistakenly call them sir and have to correct you. You're like, oh, I'm sorry. What would be wrong with just expanding our idea of how some men present and some women present?
Yeah, we were there. We were actually there. So to speak on that, I can't really speak for Blair. But I can speak for myself here. And I could tell you that I did live as a very butch woman, very androgynous. I was actually a female model in the early 80s.
Yeah, I saw you. You actually were really pretty.
So, I was also very androgynous, and it was like during that time. But that's why I keep telling you, this is a mental disorder that you cannot understand because you don't have it. So that's why it's very important that I keep telling you, I have a mental illness. I have a mental disorder. I'm not connected to my body. I don't know why. And many people don't understand why. What we do know is that this presentation, okay, because I tried to live as a butch woman. You could go look at pictures. I mean, I was pretty butch. That being said, it just was not connecting to me, and I was uncomfortable. I was hating myself. I was drinking alcohol, doing drugs, until I got sober and could sort of become this person that I am today. Then all of that anxiety, all of that stuff went away from me, and I'm a successful human being now. I own all my own businesses. I have a family. I participate in the world, and that's what I want people to see. I wasn't doing that before. I was a horrible burden to society. I was a mess. I was stealing, doing all kinds of nonsense, in jail constantly. It was crazy. So that's why I really want you to understand. I don't know why I have this. I don't know why I need to be comfortable this way, other than that it's my disorder that needs to be leveled out, and that my brain connects better when I see myself in the mirror this way. And when you see me this way, it helps me just be comfortable. And that's really kind of, you'll never understand it, because it's like, I don't understand what you went through with, your diagnosis, though I have empathy and compassion for that. I think that we have wing nuts. And this is what I want to say. We have wing nuts representing trans now. We have men who want to be women who are fetishizing it. They have co-opted this thing and made it into something that is not what it is. And it's pissing everyone off, and including me. A lot of these trans identified males are not transsexual people. They're fetishists, and they're using my space in order to gain access to other things and to override women and women's rights. I see it as a misogynist movement, and I'm not comfortable with it, especially as a biological female who fought for women's rights back in the way, and still do. I'll never disconnect from that. But that's why it's just a hard conversation to have, because I don't appreciate those people.
Well, it's interesting too that like we have so many men who are winning like Women of the Year awards.
That's
and
right.
Who are winning, taking female titles, but we don't see the same representation of trans identifying females.
Gee, I wonder why.
And it's crazy. I've always found it interesting that it's like, even with all the transition and all the drugs and surgeries and stuff, I don't think that a lot of trans identifying women are escaping their role as women in society and the way that they're treated in society.
That's right. That's right. You're right. Because you don't see guys like me, do you? How many guys like me are out there really championing for these rights? They're not, because they're being silenced by trans women who are biological men. And I refuse to let a man tell me how to run my life. That's why I always tell my trans women friends, or what you call trans identified males, are not those people. They look like, they're like Blair. They look like women. They respect women. They won't make women feel
that's not true, though. I know a lot of the people, a lot of the men that he follows who it's like, what's the one named Bell? This like,
I don't know,
ex-military guy. Holly's one of them. And I've held a couple of spaces. It's funny because Blair follows like a pretty small amount of people. And I've engaged, I've just talked to quite a few of them. A lot of them identify as libertarian or conservative. And I had hosted several, spaces. One that really blew up on, I think that it, had like, I don't know, for me, I have such a small presence on Twitter. I have like 2,000 followers, and I had
you should have way more than that.
7,000 people who were like tuning into this. It just got it got really big. And it was because I had a lot of and I call them like, I call them like the Blair White true trans guys. And and like, and we're kind of debating about, what is a true transsexual versus, just transgender, this sort of queer theory thing. And it was like these men who 100%, really believed that like they were one of the good guys, and they weren't part of the problem, and it was these other weirdos, and they really passed. First of all, most of them don't pass when you don't look at their you find like real pictures of them, you're like, oh. But like, most of them really have not medicalized all that much either. A lot of them, quite a few of them, I don't know what the correlation is between men who have served in the military and then being trans later, but that seems to be a huge thing, like Alana McLaughlin, and then some of Blair's friends. And I don't mean to put him on blast, because I also feel like that's why Ariel Scarcella never put our conversation on her main channel, because like it was going
maybe because I just want you to know that she's one of my very, very dear friends, and that's okay. She's also really solid. She doesn't get pissy about stuff like that. She has a bigger fight to fight.
I do think though that there is a little bit of just like around the whole like Blair thing, and I just watched his he did the whole debate, which was a really similar to like almost like a true trans debate. It was the conservative trans versus the liberal trans. That was a whole shit show.
That was hilarious.
But I just got frustrated because I'm sitting there listening to Blair, and it's like he's talking about self ID and stuff, and it's like, technically you guys are engaging in self ID too.
Yeah.
You've identified yourselves as trans, and you guys, have let so much of the diagnostic criteria is depends on self-reporting from the patient, right?
So now, but not before.
But
that's what I'm trying to say.
Because, like, for example, Richie, right? You know Richie, who
of course, I'm friends with Richie.
Yeah. Richie talks about having, really going through an extensive, years process of first doing, the gatekeeping that everyone says that, if we just brought gatekeeping. I know Rose of Dawn says, for 2 years people need to live as, which I don't even know what that means, living as the other sex. I guess.
It means dressing like a man and walking the world as a man. That you didn't use any
stereotypes. What, wearing pants?
That's right. It's stereotypes. That's right.
And it's but my question is, it's like, okay, so this is the magic number. I just feel like it's kind of like Fauci coming up with the 6-foot rule. It's just these arbitrary things to pretend like we're being vigilant. But then Richie did all of this stuff.
That's right.
He did all of the the therapy. He went back and forth. He was like in line, I guess, because then they were going to tell him that they were going to kick him out of the queue if he didn't go take the next step. And he went back and forth, and finally was like, all right, fine, I'll do it. And almost immediately knew, like, what did I do? But it took him years of living as trans and getting therapy before he finally went medicalized, and it turned into being, this horrific mistake. What was your process? I know that you had said that, like, you had spent a couple years in therapy, and your doctor, your therapist was like, oh, you're a guinea pig. But I wasn't your first therapist or your first couple therapists. Didn't they were not willing to give you?
Well, they didn't know. They had no idea about trans. So even my last doctor who I went to, she had never experienced it. I was her first trans, sexual patient, and she had no clue. The thing that kicked it into start was that I said to her, I feel like a man, and how she responded to me, and I'll never forget. It's why this is important. She said to me, what does that even mean? What does that even mean? You see that? That's pushback immediately. What does that mean? They're not doing that now. They're saying, oh, okay, you're bam. So she immediately, for 2 years, made me question, what does it mean to be a man? I don't even know to this day.
Yeah, sorry? What does that mean? What does that
mean? You're right. To this day, I can't answer that question. I have no clue what it means to be a man, okay, at all. What I know is what I want to visually look like to the world. I come to the world in a different way than a biological male. I'll never be a biological male. And so I have a different way. But my point, so going back to therapy, yes, this is the problem. We're now having people falling through the cracks. How come that didn't happen before? I'll tell you why. Because now more and more and more people are saying they're trans when they're really not.
Because of the internet.
That's right. I didn't have the internet. I didn't even have any trans friends. I had nobody pushing me into this space.
But do you acknowledge that social contagion is a big part of this?
100%. Are you kidding me? Abigail Schreier is one of my we're great friends. We hang out all the time. I'm in her book. So 100%, I believe that rapid onset.
So if that's true, then why, and I got to just, just be a little bit confrontational here. I hope you understand. But why then are you speaking directly to children when you're saying kids? And I know that.
I don't do that anymore. I don't do that anymore. Nope, you're right. And again, people, let me learn a lesson. Let me learn along the way. I used to say, hey, kids, I'm tramp out, because that was how I felt as an elder.
Jeffrey Marsh, I did a whole series on Jeffrey Marsh condemning him for that.
Disgusting.
You know what I mean?
I don't do it anymore. You can go and look at all my new social media. I realized what I was doing was wrong, okay? Because I was coming to it, and not as kids. I was coming into the 20-year-olds and the 30. I'm 60. So I'm coming to it as an elder.
You talk about 14-year-old. I know that you had given a speech when you were saying that, like, some 14-year-olds had written you, and this is my concern, and this is actually the reason I'm a mother of 4. I have my son just turned 10 yesterday. I have a 12-year-old. I have a 5 and a 6-year-old daughter. Well, actually, my youngest daughter, my 5-year-old, when she was really little, used to say I'm a boy. when she was super, and if I were some lunatic, I
Oh
would be
God,
like,
I know.
no,
Oh my
you,
God.
we just gotta take you to the doctor. You know?
You're trans.
Oh, I have a
Oh my
trans
God.
son.
Oh
No.
my
And we were
God.
like, yeah, we used to call her John and like joke
Right
around
on.
about it. We're like, oh, hey, John, you know. And then it was like, this is before I even got into all this. And we're like, no, you're not a boy loon. We're like,
No.
but it
No.
was funny because now, you know, and my older daughter, who's like super girly girl, like,
Yeah.
you know, princesses dressing up, you know, but they both love sports. I mean, like when I say she's a super girly girl, she still has some tomboy aspects to her.
Awesome.
You know, and my other daughter, who is more of a tomboy, has some really girly girl aspects to her. And it's like I allowed her to grow into that rather than boxing her in the second she said that.
Oh, you're awesome. That's what you're supposed to do.
Yeah. And it's just like it's scary to
So
me that it's
stupid.
like where she was about, you know, around the age that like when Jazz Jennings was saying I'm a girl. And it's like when they say, oh, I'm a boy, what she really meant was she likes the things that are typically marketed to boys. She really
That's
liked
right.
the boy Paw Patrol. She really liked Marshall, the
Yep.
Dalmatian and Paw Patrol. She always says she didn't like Sky, you know, because we like people are like, oh, she likes Paw Patrol, so they would buy her like Sky and Everest, who were like the two girl dogs. Like, no, I want Marshall.
Awesome.
You know,
Good
and
for
it was
her.
like it's so sweet and cute, and she would just wear like whatever, you know, she wanted, and she's like evolved in so many ways. And she's in, you know, kindergarten now. She asked me to shave the side of her head, and she's got this
Sweet.
long, gorgeous hair.
Aw,
Like, you know, she's half Dominican, has this beautiful, long, thick, dark hair. And
beautiful.
like, you know, she wanted to shave the side and put designs in it. And I was like, yeah, and she just looks so cute. But it's like, it's just so I tell my kids too that it's like maybe had she been feeling that way, and if I was working all the time and I didn't have the time to really sit and
Yeah,
talk to her, and if
that's
she had
right.
gotten online and
That's
gotten
right.
on fucking TikTok and all this, and my concern with these adults who are talking to kids, people like Jeffrey Marsh, and
Mhm,
you know, with all due respect, you earlier, it's
mhm.
like, you know, it's scary because it's like they're having access to people that you would never leave them alone in a
That's
room with
right.
adults, you
That's right.
know,
I
and
have
you
a
have to
kid too.
see it that
I'm a
way.
dad. I'm also a dad of an 11-year-old son, so I'm very aware of all that. I coach kids. I'm around kids. That's why I really kind of saw something that I wasn't seeing before. And I was like, kids aren't trans. Kids
Right.
are dealing with kid shit. I dealt with kid shit. My parents let me be a tomboy and let me be that little boy, and it wasn't an issue. And then I got older and things started to move forward. And I, you know, sort of more about my sexuality and expressing myself through my sexuality and sort of connecting to becoming a gay woman for many years. But that being said, I the system is broken. The system is broken, and it has been
So
broken.
going back to my question, what then, you know, if the whole thing is okay, we need to gatekeep more and we need to create, you know, a system. And we've
Yeah,
seen that the system, you know, no matter how it's been designed, whether it's that sort of immediate entry or it's been, you know, long discussions, like even, you know, you saying that like, you know, you would kind of like shopped around with therapists a little bit, you know,
mhm,
finding one that would affirm you. My concern is it's like, anyone can do that when you're in it, and we know that like cross-sex hormones will actually aggravate feelings of dysphoria. It'll
that's
actually
right.
intensify them, right?
That's right.
So it's like, you know, people want what they want, and if you have these comorbidities of obsessive compulsive disorder
Yep.
or, you know, drug addiction,
Yep.
alcoholism,
Yep.
and I hate to say it, like even before you told me that you know you have a history with addiction, you know, I have a
Yep.
lot of experience. I was a birth worker. I used to be a community birth worker, and I worked a
Excellent.
lot with, you know, moms who are on methadone clinics and things
Yeah.
like that. And,
Yeah.
you know, I see like even just kind of like, you know, with the porn and other stuff, there's just a
Yeah.
lot of sort of addictive
Sure.
behavior, and it
Mhm.
seems like a manifestation you know, when we talk about
Possible.
addiction, it's not like it doesn't have to just be, oh, they're taking drugs, or oh,
No,
they're
not at all. Not at all.
alcohol. You know,
That's
it
right.
manifests in a
That's
lot of
right.
different ways, and
That's
sometimes
right.
there'll always be that addictive behavior, and we've just
Mhm.
sometimes have to manage it in a healthy way, whether it's,
Mhm.
you know, working out, but
Mhm.
having people keep an eye on you and make sure it doesn't get out of control.
Mhm.
I mean, is it, you know, I just don't see how we can really safeguard these things. And if it's not, you know, I don't know what do you think would be an appropriate sort of safeguarding for adults?
Well, it's a great question, and I'm not necessarily think I can actually answer that straight up because the system is completely destroyed at this point. And it's why I keep going back to, we need to first off get rid of affirmation therapy. We should be trying to get people out of dysphoria, not into dysphoria. Medicalization should be the last thing you ever even try on somebody else. And so that being said, I think the problem today that I see is too many people can just be trans. You can go to Planned Parenthood, and if you don't know, Planned Parenthood should be really scolded for what they're doing right now. They
Yeah.
got
We're
straight
planning a protest.
Yeah,
Anybody
it's
out there,
gross.
we're planning a protest at Planned Parenthood's headquarters in New York City. If you want to join us, email me
Excellent.
at a slightly twisted female at gmail.com, because
Excellent.
they're
No, they're out of control. And and that's one of the problems. Anyone can get testosterone now. Anyone can say they're trans. Anyone. And so if you notice, back when I did it, there were no detransitioners. There were none. Now today, we literally almost every day, some kid is like, whoops, I made a mistake. Whoops, I made a mistake. And the trans community is trying to hide that. I'm trying to bring it to the top and say, these people are trying to tell us something, that it's wrong. So I think you said Richie went through the system, and then he went through a whole, that's in the UK as well, right? Which they've shut that whole system down because yeah, it's disgusting. Now Richie has to deal with all of that. Now, I don't know why some people transition and why some people don't. I don't know why I'm perfectly okay 30 years later. And I don't know why some people all of a sudden decide it's not for them in 5 or 10 years.
I mean, do you think part of it could be the fact that you've been so positively reinforced by, I feel like so much of the sort of like fame and being able
But I
to
didn't always have that
career.
fame. I didn't always have that fame. I had 10 years of transition time before I even got into sort of the internet or anything like that. So I had 10 years of living without any influence.
Didn't you transition at one point for a little bit?
Never. I've never,
Okay.
never. I never even think about doing that, to be honest with you. It's not,
Right.
and also I understand the position I'm in. Please understand that. It's hard for me to be here because I get that people see me, especially young people. And they're like, well, look, Buck did it and I want to do it. You don't think I don't know that? You don't think I don't think people think, well, if Buck why is Buck saying that? He did it. Right. Now he's pulling up the ladder. That's what they keep saying. I'm pulling up the ladder. Yeah, I'm not pulling up the ladder. I'm securing the ladder. I'm securing it so no child goes through this, and then we don't even know the damage. You watch, mark my words here. 10 years from now, 5 years from now, there's going to be so many of these young girls who are like, where were the adults? Why did you let me do this? Chloe Coles. There are going to be tons of Chloe Coles.
But don't you see a little bit of like, I just feel like there's a little bit of like, do as I say and not as I do.
No.
Because I think that when we're talking about like mentally ill or upset, I think like OCD is a sort of underappreciated element to this.
Yeah.
I think when you're obsessive compulsive, when you've like sort of latched onto an idea and you begin obsessing about it. And I think that, like, again, when you have people like, Blair, just even going for when he did the whole Jubilee, debate, it's just this idea of like, and even you say you're like, oh, it was wonderful for me. I mean, first of all, I think that that's objectively not 100% true, considering that you went septic, right? I mean, it almost killed you transitioning.
Well, I mean, okay, so right, and that's why I talk about it, because I don't have to talk about the problems in my body. You would never even know that, and it would just look like, oh, bucket. But I do that for a reason. If I didn't care, my friend, I wouldn't talk about the horrible aspects of what happened to me. Again,
I do appreciate that.
And choosing this. So that being said, yeah, but even with that, you must understand, even with that, for me, it's the quality of my life, not the quantity of years. So for me, my quality of life has changed. I'm sober, I'm focused, I'm a business owner, I'm a family man, I'm all the things I ever wanted to be. And that is what I want the world to see. This is not for everyone. This is a very, very small disorder. All of a sudden, all these people have it out of nowhere. It's social contagision. There's no doubt in my mind about it. And this isn't for everyone. And not just anyone should transition. You should go through a system. And so going back to the system, I don't even know how to fix it. I'll be honest with you. And I don't know what we should do. But I do think we should really start to hold these organizations accountable, like WPATH and like the Medical Association and the American Psychiatric and the American Pediatrics and all of them who are on board with giving children Lupron. These people need to go to jail.
Right.
What? Who does that to children who are healthy? There is no such thing as the wrong puberty. I went through female puberty. I'm a healthy adult at 61. I'm strong as an
But
ox.
that's the thing that I don't understand too. It's like you get these, you know, I mean, I think one of the most evil fucking people in all of this is Marcy Bowers. And I
Oh,
mean,
God.
and to again, and it's like they sit there and even like Dylan Mulvaney, who
Oh,
totally promotes
okay.
medicalization of children. And it's like,
Right.
Dylan, you sat there and you talked about how you're trying to quick freeze your sperm because you want to be able to, have a family one day and how that's
Oh my
important to
God.
you. And it's like, how fucking dare you
That's right.
there and promote the idea that
That's
some
right.
children need, early medicalization that we know results in sterility 100% of the time. I like I said, I have a 10 and a 12-year-old, so I've had 8-year-olds before, children who
Yep.
are 8. I can
Yep.
tell you, this was knowing what they want for their future is so not even. They're trying to decide if they want to play, soccer or flag football more.
That's right.
What's more important, or
That's right.
I mean, stuff like that. Learning how to read a book.
Well, that you don't think that pisses me off when I see Dylan Mulvaney, who transitioned a year ago, the head of this whole, and then the people they bring to the White House or out of control, showing their, but that's not anything to do with trans. Those people are.
But is Dylan? But I mean, Dylan Mulvaney, is he trans or not?
Honestly, if you had to ask me, I would say no. But I don't know. I'm not a doctor and I can't diagnose him. He's an adult and he can do that nonsense all he wants. But that being said, the long time I've been in this system and the trans women I know would never look like that. He's going on looking like a man. And dysphoria, it's like me going on looking like a woman. My dysphoria would freak. And that's why I'm like, wait a minute, dude, you're showing yourself to the whole world like this and you don't have dysphoria then. You are doing all of this. And yeah, they need to be held responsible for what they're actually showing children. Young people follow those people. Jeffrey Marsh, who attacked that Muslim woman because she outed him. And then that stuff is weird and sick and it has nothing to do with trans. That's why, oh God, it's just frustrating for me because these are the people who are representing a community of people who have a mental disorder, and they're making it worse because now people are like, look, they're all nuts. They're all a bunch of Oh, I can't say that on here, but you know what I mean.
Right.
So yeah, now we're attaching, they're calling it maps. They're calling it maps. Are you kidding me? And attaching that to the trans label. I'm done. I'm out of here.
Go. And that's, yeah. And I mean, so, and there was a time though that you had talked about like, the whole map thing. And I guess like, needing to sort of understand, where these people are coming from.
What I said was, I understand why people are doing research on this. Okay. But I said, because we need to research things. You have to research why are serial killers. If we don't research it and we don't understand what's going on, how are we going to sort of work with these people?
Right.
So I'm not saying it's okay to be a map. I've never said that. It's not okay. Number one. Number two, what I said was there was a guy, a trans guy who did a research. You know who I'm talking about. And he started putting it out there like, ooh, we need to look at this as a sexuality. And I'm like, what? And I called him out. And so, no, I said we need to do research, but we do not need to attach it to trans and LGBTQIA plus PP poo poo. Like all of a sudden, everyone's attached to LGBT now. That's just gross. So no, I am not okay with that. I think it's disgusting. I'm not cool with any of that stuff being attached to my mental disorder. It needs to be studied. That's what I said. And it does need to be studied, but in privacy.
if so, are you, and you don't have to answer this if you don't want, just because it's a personal medical question. Are you still taking testosterone now?
Yeah. Forever. Okay. That's what I'm telling people. Like, it's not the life of joy. Stop saying trans joy. It's not, this isn't joyful. It's a way that I'm able to function in the world. You don't think I have to think every morning when I wake up who I am and what I am. It's not easy, people. But
if there was an option to be cured, would you?
I'll be first in line, friend. First in line.
Yeah, without.
I don't want to be this person. That's what you have to understand, that these people want to be trans. This is not something I want. It's something I am. It's something I've been diagnosed with. It's something that has alleviated my dysphoria, enabled me to become a part of society, which is what all of you should want. You don't want me to be a burden to society. You want me to participate. If me and you were walking together down the street, you would never even notice. You would see me with my dog and my kid, and you would say, hey, dude, what's up? That's what I wanted. That's all I want from you. I want nothing from you. I don't want your space. I don't want anything. I just want to be able to walk down the street with you on the other side, if that's how you're gonna be. And so
sorry, like in terms of like your connection's a little bit.
Oh yeah, well there you go, paying for those internet connections. Here, hold on one sec. Let me see. I took off the live straight on. Is that better?
It just,
let's see.
I can hear your voice. Your video is just a little bit pixelated. That's okay. I can see you. So I guess still, and I think where I just start to get like just a little bit scrambled with it. It's like I just don't understand, because I hear a lot of people who are advocating for like the transsexualism and sort of acknowledging that, oh, that's better, your thing's better now, as sort of a different thing than the transgenderism, and even this idea that people like Dylan Mulvaney, who I think is obviously it's just I think it's such an obvious grift. I did a video series on him too, and just bringing up, it was just like I just see this like histrionic personality disorder where it's just like attention by any means possible, and that's sort of like the route where as a high effeminate gay man, this really campy gay man who was in a musical theater, he had no attention. But the second that he put on a dress and started claiming himself a woman, which I think when he first played with that was he actually had done this, I think it's Wegovy or whatever. It was some HIV medicine that he did a commercial for. He was hired to do a commercial where he played a trans woman, a trans identifying male, a trans woman. And it seems like that maybe was the first time he got to put on that role, that costume. And he was like, oh, wow, and it was whatever. He had to pretend he was like, oh, like, tell me more. And they were singing and whatever. And it was like, it was aimed towards, men who have sex with men and whatever was HIV testing or some sort of treatment. And then I just saw him sort of like, from there, he starts to evolve into, he was on The Price is Right. He's been on Ellen DeGeneres show. This is all prior. So it was like he took any opportunity he could to get some sort of airtime. And then it was like the second that he put on a dress, realized that it's the sort of the height of this like trans craze, and really hopped on as, like, this is his ticket to finally getting the attention that he had, so desperately wanted. And I guess like, I don't know. I just still like, I want, we're talking about like, okay, it's the other wingnuts. And I think, we can pull out some really, bizarre examples of people. But I think that my concern is, right, when we're criticizing the sort of like transgender, right? People say that they're transgender, and maybe they've got like all the crazy hair and like the requisite, septum piercing that every single one of them seem to have. And it's like, and like the ones that seem so obvious to make fun of, some of them have medicalized, just as much, right? And I think the thing is, it's really more about which ones pass and which ones don't. Yeah. And I think some of them actually might even be making a genuine attempt to pass, and they simply don't. And I think that the sort of the contradiction in, like, for example, Blair White, who says, I just want to assimilate into society. It's the same thing that Rose of Dawn used to say, we want no one to even notice. We want to assimilate and things like that. But at the same time, we're against childhood transition. However, the whole idea is, if you don't, and Blair says that, if people immediately get upset when you come into the bathroom, then you don't belong in the woman's bathroom, right? If you could kind of come in unnoticed and do your thing, and it causes the least amount of upset to the women in there, then that you are allowed in that space or whatever. It's it's okay to be in that space. But it's like for these men who are never going to pass and people who realize that, then it's still sending the message that you want to take whatever steps you can early on. And I've heard a lot of men say that if I had started transitioning earlier, only if I had blocked my male puberty, it just gives this really like conflict of, if you can properly transition. And then it's also sort of like pushing the sort of trans med, the true scum narrative where you need to medicalize more. And that's a dangerous narrative too. Right.
Sure. Yeah. I hear what you're saying.
Yeah.
And that's why we land in this very difficult space, because on one side, we're saying this really worked out for us and it's fantastic, because I can't not say that because it's true. But at the same time, we're saying, hold on, though, we made these decisions as adults. But that being said, then we have this passing thing, right? This is not something that just magically came to me. I have to work. I have to work on looking this way. It doesn't just magically happen, right? I work out. I make myself as masculine as possible. I do the same with Blair, same with people who pass. But so going back to puberty blockers and that, I don't care what anybody says about, well, if I would have taken it, anyone could say, well, if. Right? Anyone can say, back in the day, if I didn't do drugs, I might have been a different person, right? Of course, we can say all of those things. But this reality stands that puberty blockers are not helping. They are actually hurting, and they are going to do damage to your physical body that will never, ever be repaired. Sorry you have to grow up in your male puberty. Sorry you have to have an Adam's apple. Sorry you have to have big shoulders. But I'll tell you what, you're going to benefit from that, and you can fix those things later on as an adult if you need to do that. That's where I stand, and I don't care what anybody says. That being said, you cannot medicalize a child. That the child can't consent to that. That's non-consensual surgery, hormones, and actually destroying somebody's health without them being okay with it.
Right. What are your thoughts on phalloplasty and metoioplasty? Are they ever something that helps, or is it just...
in my opinion, again, vaginoplasty, I don't have any, right? I know people who've gotten it, and I know people, I've had mixed reviews. Some people love it, some people hate it, right? Again, we're not all the same, right? We're not a monolith. Some people, so I don't have surgeries, right? I only have my top surgery. But that being said, I never got that surgery because it doesn't function right, though I have friends who have it, and I don't necessarily agree with that surgery. But
again, you think anybody is like, wow, this is great?
I've never met anyone who said that.
I can't imagine. I mean, like, as like, like a bisexual woman, like I've had sex with men and women, but like, primarily men. I always say, like, if somebody who for some reason got past my radar, which I can't imagine, but like, and it's like whipped one of those things out of me. I go, oh, sweetheart.
It's sad. Do you know Scott Nugent? He's a good friend of mine, and he really champions for that.
Does he still have it, or did you just get it taken off?
No, I think it's kind of there, and it's just a mess. And
Scott seems like a really good person.
Oh, he's a sweetheart. I just really, and he still goes by he, but I just love him a lot. But he also stands up to this nonsense, and he's showing you why you should never. I never got that surgery for that reason, and I'm perfectly okay with it. And I'm fine, and I walk the world perfectly okay. But my point being is, every day I get up, I have to see my different kind of body. So trans isn't beautiful. If I could have been born a man, I would have chose that in 2 seconds over this.
Right. What is your response to people like, I don't know if you saw Carol, who is a detrans butch lesbian, who I know has made a pretty critical video about you, and then also I think Joey Bright, who I know has also had some critical things to say in terms of your impact on. And I just want to put one little, just so again, I don't like taking people's words out, but I think it's just more helpful so that we can actually.
I mean, you're going to have haters. You have haters, friend. We all have haters, right? There's people who just don't like what you're doing or find things they dislike about you. That's okay. Like I said before, I'm not going to please everybody. I'm here for a reason. I'm an older trans guy who has an amazing life, and I don't need to get that.
Right. Well, no, not even just in the sense of what they're saying. If you think that there's any validity to it, or if you just think that it's just
cool.
hating. Let me just
cool.
Too. Absolutely did.
Oh, wait, let's see.
Watch the documentary a lot. I especially watched that documentary a lot when I was stepping up to the plate to transition, because it made me feel like transition would work out for me. Thanks, Buck, by the way. You really, really helped me out there. And I'm sure you helped a lot of butch lesbians out. You should be super proud of that. I don't excuse myself out of this too. As a trans-identified person for 4 years, I also played my role in being destructive and hurting women and hurting other lesbians too. Absolutely did. I fully fucking admit that. And I'm sorry to all the women I hurt, and I mean that. Instead of me just continuing to talk about personal experience.
That's okay. That person clearly is dealing with some mental health stuff. And I'm not the reason why they transitioned. They transitioned because they took it upon themselves, and they need to take responsibility for that. I never championed this. I said, this is me. Everything I've ever put out there has been about me. And so I'm sorry that that person, remember when I transitioned 30 years ago, right? I was in a butch lesbian community. They all hated me. Not one of them understood what I was doing. I got ousted from the butch lesbian community because they called me a traitor. So now all of a sudden, these butch women later in life are transitioning. That's has nothing to do with me, and I will not take responsibility for that. And you have to learn to take responsibility for your actions, people. And it's like me drinking. I'm going to blame everybody because I was a raging alcoholic. No, I blame myself and my trauma that I was dealing with and not having that. I think that's one of the problems of the internet, right? We can point fingers at everybody and say, that's the problem. You made me do that. Or, no, I didn't. I put myself out there and helped some people. Oh, I can't hear you.
Sorry, I'm muted.
Okay.
I don't know, because, even though, like I said, I guess, like, I'm technically bisexual. I never really was like part of the community, or like,
sure.
Even though, like, even like I had girlfriends. It's so weird because it's like I used to always call myself straight, but then people are like, you literally like dated girls in high school. Yeah.
Yeah,
right.
That's my bisexual.
Yeah, I guess you're right. Yeah. So it's like, but still, like, I never, like, to me, it was never like this big, like, part of my identity, or like something that I, like, had sought to find community around or whatever. But like, I know, a lot of other people who kind of have, and then there was this sort of forced teaming of, even the LGB in a way is somewhat of a forced teaming. And then especially, with the TQ, because LGB, which is lesbian, gay, bisexual, is about homosexuality.
That's right.
Sexuality. And then TQ, which is, about identity. Where was I going with that?
Yeah, but queer. But let me just say this real quick. Queer is gay, by the way, people. So all of you people out there, it's pissing me off. Like, people who aren't even gay are using queer. Like, what? Gay? Queer is gay, people. It's same-sex attracted. You can't.
No, that's the thing that never. It's the same thing with gender. Gender was always just really
That's
like
right.
a watered down way to say sex, because everyone feels so uncomfortable saying the word sex to kids. So we're having like a sex reveal party saying gender reveal, and then it's like they turn this whole other meaning into it, which it always was meant to be interchangeable with the term sex. And same thing, queer was always a slur that was reclaimed by the homosexual community that was meant to, like that man over there, he's a little queer. You know what I mean? And it's like really just saying that he's got some homosexual tendencies or whatever.
That's right.
And then now it just means like spicy straight. It's like these like straight couples. I know a midwife that I used to work with, and I used to really be close with her, but like I had to take a step back. Yeah. She's like, I'm queer, me and my, but it's like you and your husband, you guys are straight, you guys have biological children, and like you're acting like you're oppressed under the umbrella. Like,
that's what they want. It's a co-opting of my community. I'm telling you, it's co-opting. You're not queer unless you have sex with the same sex. And that's it. Period. Get out of here. You're not queer. Queer is not something for you to take. We fought for that. I remember how old I am. I fought. I lost all my friends to AIDS. It's not funny the way these people are treating our community, and I find it disgusting. And we're lapping on all this TQIA, pee poo poo, blah blah, so anyone can be part of the LGBT. It's insane. It's not right. I'm gonna have to head out here, if that's all right. I can't hear you. I can't hear. Oh, what happened? Oh, I see your mic is. There you go.
Hold on. Okay, I guess just one last thing. If we can, like, do you have to go like right this second?
Well, like 5 more minutes or so, if that's all right. I have, yeah.
Yeah, sure. No. And I really appreciate you coming on.
I appreciate you too.
In terms of, again, like, just, you know, how do you sort of reconcile the sort of, like, I guess, space of one thing I didn't, oh, am I breaking up? One thing I wanted to ask, didn't ask, that I was starting to ask. So Joey Brighton, I don't know if this is accurate, and you can tell me if it is or it's
Okay,
not.
great.
But her her, I guess bone to pick was, she said that at one point early on you were bringing testosterone to lesbian bars. Is that accurate?
That is a complete, and wow, that person actually said that.
Yeah.
That is a complete lie. I would never do that. First off, number two, when I transitioned, lesbians were not transitioning. So okay, that actually upsets me. As you notice, I sat here all day being honest with you.
Yeah.
Clearly honest. That is a blatant lie. That is wrong. And I'm going to actually make sure that that person apologizes to me publicly. You can't say stuff like that. I am a person
I think that's
of
where there's
integrity.
a lot of pushback from, like, the butch lesbian community.
What? I would never. First off, good luck getting testosterone. You think I'm going to share something that's already hard for me to get? Secondly, I don't want anybody. I've never wanted anybody to just transition. That is not true. I sat here and told you, you have to go through a system. I'm not polling. I'm not an indoctrinator. I'm in fact somebody who's like, slow down. You don't need to transition. Hold up. So that person is a blatant, total liar, and how shameful. So now you're going to believe everything else that person says right there. They're just blaming me. They're blaming me.
No, that's why I'm glad, that's why I'm glad, I prefer to actually just talk to, the source. And I think it's important to clear that up, because I know that is something that, I know that has gone around, and I know that, Carol talks to that. And I think that maybe that's sort of where she's coming from, feeling like, the influence on the butch lesbian community, there's
how funny things changed. When I transitioned, they all hated me. Now, right? And now all of a sudden they're all transitioning, and it's my fault. Right. You see that? And this is one of the problems with being an elder, with being somebody who did things early on. You just get blamed. And I continue to get blamed by both sides, by the detransitioners and by the trans communities. I told you I'm in a very difficult space, but I don't give a F, because I'm here for the kids. I don't care what any adult says to me. Say whatever you want. It's ridiculous. But that being said, I will never go away. I will never shut up. I am here for the children. Children should not transition. I don't care what you say to me. Bring it on. Debate me. Anyone out there who wants to debate me, I'm on your channel. I'm sitting here today because I have integrity, whether you like me or not. And I'm willing to sit here and have the conversation. You don't have to agree with me, friend, but you have to accept the fact that I chose to do this. I live in a
I do. I appreciate that. I think that, I know I've tried to get Blair on here a few times. He won't acknowledge me. I mean, you honestly immediately stepped up and offered to talk to me. And I know that, and I knew that you probably knew that you were stepping into, the lion's den a little bit.
Because I actually respect you. I respect you. I respect your opinion. I hear you. You don't think I hear you, women, saying the things you're saying? It hurts my heart. It hurts my heart. I actually care about you. I care about us living together. I care about women's rights. I care about women moving forward. I know where women stand in this world. They do not have the same rights. I'm a man now. Oh my God, the privilege I have. Honestly, it's real. You don't think that I don't see myself as the female form not getting the same things you get now because I look like a man? I get it. That's upsetting, and that's not right. So I'm here because I believe in women's rights, and I believe that what's happening is not okay.
Just really quick, one other thing that I wanted to just get your input on was, I guess there was there was the famous case of the woman Rose who had been who had sued Pornhub trying to get I guess she had videos of her rape at age 14, by some pedophile that were circulating on Pornhub. And she worked for many years to get these videos taken down, and as somebody who, I know that you're a pornographer and
I'm not a pornographer anymore. I did the work. I do not work in porn anymore. I make products, adult products. I do not make pornography. I did. Okay. Yes.
What are your feelings now on, the work that you've done before? And I don't know if it's accurate. I think Karen Davis had one of the things that she had called you out for was I think it was somebody, Rose was saying something about Pornhub and then had gotten in a fight with, I think, either another porn actress or something. And I don't know if maybe you didn't realize who she was, but you had said something, you were like, fuck these haters.
Yeah, again, the internet. I might have said that. Right. There's no doubt in my mind I said that. That being said, I do not condone any of that being put on the internet. I that is disgusting and wrong. That's why it's hard to be in the pornography business, because whether or not you believe it or not, we do have rules and regulations in that industry, and stuff like that is not something we like. And I have a lot of friends in that industry. So that being said, I was not citing that anyone should have that up on the internet. I'm 100% completely against that. Now, that being said, the internet is horrifying. You know that I could literally make something right now and upload it to the internet. Something gross and disgusting like that. And so it's hard. That stuff.
What is your position on porn now?
Well, it's adult entertainment. I believe that it's an adult space. No children should be seeing it. It should not. It should have a lockdown on it. I actually believe that pornography is a positive thing for some people. So it's not for everyone. It's not. But some people benefit and some people like it, and they should have opportunity to access it. But it's an adult space, period. Period. And it's not for everybody, and nobody should be seeing things that they don't want to see. You're never going to get rid of porn, just so you know. It's why it should be legalized, because if you don't legalize it, it's going to go underground and it's going to get sick and nasty, more nasty than you've ever seen in your life. I'm telling you, it'll be the Wild West.
And do you think it's like, do you think that some women benefit from participating in porn, or do you think that
Okay, that is a very difficult question to ask, because yes, people I know who work in the industry actually like it, but I know people who've worked in the industry who hate it. So it's a very personalized space. You can't put a blanket statement over all women and they're all being forced into it. That's not true. I know lots of women who actually enjoy it, built their own business from it, actually put themselves through medical school because of it. So that being said, it again, right, nuanced. You can't, of course, we see it as a very patriarchal, horrible, and there is parts of it that are like that. But then there are women who actually have taken control of their lives. It's not, you know what I'm saying? It's just not an easy answer, because I think it's a personal answer that some women like doing it, some women hate it. And forget men all, that's all. But for women specifically, some women have benefited, I think, and some women haven't.
Genevieve Gluck is here, and she
Hi,
said,
Genevieve.
Yeah, she's amazing. She says porn creates a demand for trafficking. What is your position?
Well, of course, because again, that's why I said we have to have legalities around it. We have to have rules around it. You're never going to get rid of it. But the really horrible stuff is the stuff that creates trafficking, not the actual professional business. No way would they ever. We have laws, regulations, we have paperwork we have to do. You don't even understand how hardcore it is.
But don't you think that legalizing it makes it very difficult to wade through then, the porn that is coercive?
Well, that's the problem we have now. So OnlyFans, all of that stuff, right? 100% it creates a bad space there. So does a lot of things, right? But are we going to get rid of it? How do we find the space to sort of work in that area to make sure these trafficking? There are organizations in the pornography business who are anti-trafficking, who work very hard to make sure that these things don't happen, because we want to make it accessible to consenting adults, like alcohol, consenting adults.
And I guess my last question to you is, if you acknowledge that some of your rhetoric in the past has been, harmful in terms of, children and, and I think that even continuing to say, about, just honestly continuing to promote how positive, medicalizing and transition has been for you. plus with some of the old, I know that there's still some old clips out there. Would you be willing to go and take some of the clips that you
Well, that's good luck.
no
Good
longer,
luck.
well, not
And
take them down, but no longer agree with, and put out a statement and acknowledge which parts, that maybe have been harmful, and that you no longer, stand by? Would you be willing to,
you mean statements I made? I already do that. I say it all the time on my live YouTube channel. I say it all the time. I used to be for puberty blockers. I used to be for transitioning kids. I am no longer. I say it all the time. I'm very publicly open about talking about that.
and what are you
Pornography.
doing to fight?
I stand by my pornography. I will. I'm not going to tell you that what I did is bad. It is not bad. It is my pornography that I did as an adult to make for other adults. And I'm not going to. I don't believe my porn is bad, and I don't believe what I did is bad. I believe what is bad is that it's accessible to underage people. That's what I think is bad. And so I'm telling you that I don't think my pornography is bad.
And you don't think there was a conflict about, sort of tailoring your rhetoric towards children while at the same time selling, like, sex
Well,
toys?
back in the day, yeah,
pornography?
100%. I should have never said that about kids. I shouldn't have said, "Hey, kids." I should have never done that. 100% own that. I did not realize what I was doing, and that because kids started to transition. Back in the day when I was saying, "Hey, kids," it was literally focused towards a adult group of people that were younger than me, not
Right.
kids. But now the weirdos like Jeffrey Marsh are going, "Hey, kids, leave your family and come to me." Like that. I don't want to be associated with that. Everything I've done has been in an adult space. And so that I will always stand by that. Continue to make adult products for
And then
adults.
I guess just finally, and just in terms of, from like a free speech perspective, like I know Rex Landy, for example, and I don't know, she was, I think, banned on Twitter. I think she regained access. I think she believes, and I don't know if this is accurate, that you might have reported one of her tweets. Do you report tweets of people who call
Of
you
course.
a woman?
If never. I report tweets where people call me the P word, which somebody did who's probably in this room now. Don't you ever attach that word to me. So if you call me those names, you're going to get reported. If you call me a woman, I don't care. I've told you guys that a million times. I'm a biological female. Yes, I am a female. Call me it all you want. Go right ahead. It's respect to call me he. And if you don't want to respect me, that's perfectly fine. It's not going to make or break my day. I'm going to leave this thing and have the most amazing life today because that's my life. So, that's the problem, is that I get what you're trying to do. I'm not dumb. And so that being said, I know your intentions by calling me she or doing those things. Why would I report it? I'll just either block you or mute you. Like, I don't.
What do you think people's intentions are?
To say that I don't exist here as a male, and that I'll never be a male, and that you are a man. And I know that. I've acknowledged it. I'm not a man. I'm a transsexual.
Do
Okay.
you think do you think that that's with the intention to like disrespect you?
Yes, 100% I do. 100% I do.
Or
Because
do
the
you
people who respect me on Twitter who go, I know you're a biological female, but I'll respect you, Buck, because you respect me. Women say that to me all the time. Women who are what you guys all call TERF, which is also totally insane. You're not a TERF. You're somebody who's trying to have a conversation and feeling threatened.
Right.
I mean, if you want to take it on, you're a TERF, because I'm considered a TERF too. So I guess we're on the same team.
Yeah. Well,
It's so crazy. Oh,
yeah.
man.
Yeah, I don't know, but yeah, and I, like I said, I do appreciate you coming on. I think that I think a lot of damage has been done from previous rhetoric, and I hope that you continue to do the work to confront
Right on.
some of those things. And I think in any ways that you might have profited off of, I hope that you're, and just to answer, in terms of like I'll call you she, her, and it's actually not to disrespect you, as
Whatever makes you happy.
personally. The reason why I use, proper sex-based pronouns is because I believe that, language is instrumental in, eventually, how we formulate society, and it leads to the changing of laws. I think that when we begin to validate things like gender identity, it starts with language, and then it can evolve into, okay, well, she, her, and if we're saying she, her, if we're saying he, him, then we're saying that, you know, some men have vaginas, some women have penises, and eventually when that culture begins to adopt that as truth, it will change the language insofar as, and we've already seen it now with the dictionary, such as, you know, a woman is somebody who is either an adult human female or somebody who identifies as a woman. And once we change that definition,
I agree.
Every piece of legislation where the word woman appears now has a meaning that includes certain men, right? And vice versa. Every single piece, you know, whenever we talk about men or keeping men out, or the differences, you know, of men, it then includes some women. So I really believe in gatekeeping and maintaining truthful speech because of, you know, the broader implications and how that sort of turns into eventually, you know, legislative changes, cultural changes, and things like that. And it's not to you know, insult the individual.
I don't feel insulted because I agree with a lot of what you said. And I don't think it helps me as a transsexual to pretend that I'm a man, because not only for medical reasons, but I'm not. And I'm a special kind of person. I'm a transsexual person. And when you start to sort of mold me into men, then it takes away actually who and what I am and my disorder. And again, I'm going to keep repeating, this is a very small disorder. It's always been, it always will be. So what you see today and the explosion of it says so much different than what I'm trying to tell you here. It's a social contagion for young people because they want to belong to something that's cool and hip. They're getting tons of accolades for being trans. I don't want accolades for being trans. I just want to live my life. So that's where there's that difference. I've never, ever tried to change the language. That's never been a space for us transsexual people. We want to be men and women. Why would we want to change the space? Why would we want to take your space? We just want to sort of move in. And we've been around you for many years. You didn't even know it because we just sort of respected being around you.
Right. Right.
Yeah.
Well,
So I'm not okay with changing language, just so you know. I'm not okay with saying people have uteruses or people have periods. That's gross and wrong. And it's not true. People don't have periods.
So do you report people for do you report people for using she, her pronouns?
No, I've never, ever reported anyone for doing that. I report people for calling me names like P, or, you know what I mean? Things like insane, or you're just a POS or whatever. That's, I'll report you for that. But, and also because that person called me the P word. Don't ever call me the P word.
You mean Rex Landy?
Yeah, I think that's
is that you're talking about. Yeah, you know, and
never call me that word because you'll be reported. And that's it. I'm just asking you. And also, if you don't like me, you just don't have to engage with me. It's the internet, people. You know, you're not going to stop me. I'm going to tell you right now, you're just not. I'm going to have conversations with you. Me and you are going to eventually walk on the other sides of the street together, hopefully, and we don't ever have to engage.
Yeah, again, you know, and I think the concern was, again, you know, just at the time of having been, like, you know, an active sex worker and you know, pornographer, and also, you know, marketing and making money off of
I sure did.
sex paraphernalia while talking to kids about sex.
I don't talk to kids. I did it before. I did it before and I stopped, and I do not do that anymore.
Right.
And so if you're asking me if I give, or is that what you're asking me? Do I give some of the sort of finances that I have been given in my work of here? Or is that what you're asking? Do I donate to organizations? I donate a ton of time to many parents, many organizations, my time that I don't get paid for, in order to show them that they need to get their kid out of dysphoria. You have no idea how many parents I've helped not have transitioned their children. And because I tell them, get them off the internet, get them off TikTok, get them off. And I'm telling you, they're like, oh my God, my kid is back. I'm like, because they're being influenced. They're not trans. I know these kids aren't trans. They're literally being influenced to be and take this.
Right. Yeah.
So,
you know, and so, yeah. And I just think, you know, I just hope that, you know, you'll continue to consider how, you know, your rhetoric, and if we do acknowledge that social contagion is a thing, you know, even with adults who maybe are suffering from, you know, autism or other, you know, mental disorders and things like that. And,
that's right.
You know, like continuing to tell your story. And I do appreciate you coming to talk.
Thanks, friend.
If you have
Thank you,
any
Jen.
other thing that you want to ask me too,
No.
feel free.
No, but anybody can reach out to me if you have something maybe we didn't touch on, and you're more than welcome to ask me.
Cool.
And I appreciate your
How can
time
people
a
get in
lot.
touch with you? What's the
Oh,
best?
but Twitter is easy, right? Or X, whatever you want to call it.
What's your handle?
Instagram, Buck Angel, and
All
Buck
right,
Angel
so
on Instagram as well.
yeah, so anybody who wants to get in touch with Buck, it's at Buck Angel on
Yep,
Twitter and Instagram,
yep,
and then
yep.
you have what buckangel.com.
Yep, you can reach me there as well. That's
Yeah,
right.
awesome.
Totally.
All
Thank
right,
you, friend.
cool. Thank you so
Awesome.
much. I really
Yeah.
appreciate you coming on.
Yeah, I appreciate you too. Have a great day. I'll
You
see
too.
you later. Okay.
All right, take
Bye.
care. All righty. Wow. That was interesting. Yeah. I man, I'm gonna have to go ahead and process some of that. Oh Lord, can I get some? Andrew Willis says, Brittany, can you get some paper towel wet, please? Beautiful girl, bro. What? Yeah, that was intense. I tried. Isaac, thanks for being here, guys. Genevieve, yeah, should I do like a debrief? Should I do it now? I can debrief now, or should I start a new live stream? Oh, Joey Bright never said that. Oh, I'm sorry, Joey. I'm sorry. I apologize. Somebody told me that, and that was one thing that I wanted to confront her about. So Joey in advance and Buck, Cyber, who I think is close with Joey Bright, says that you never said that. I believe you. So I am sorry if I repeated something that wasn't true. So clear Joey Bright's name. Yeah, let's do a debrief. But I'm going to end the stream, and then we're going to restart the stream, and we'll go through some. I was really nervous. I'm not gonna lie. I've never been nervous. I mean, literally, I tell everybody this. I did, my Posey Parker. When Posey Parker came to Philly, I was like tripping balls on mushrooms for that speech, which they had to take. They had to take the microphone away from me because I started talking to the trans. I was like, guys, listen, we don't hate you. We just want you to know, like, it doesn't make any sense. I was like, all right, give me the microphone. And then I was also tripping balls during fucking Benjamin Boyce. That was fun. Benjamin Boyce's interview was really fun. He was really cool. He was really nice to me and like super low key, but like, yeah. So I'm usually not nervous. I was nervous for this one. I just didn't want to like scare her away, but I wanted to hold her accountable. All right, we're gonna do a follow-up. Ella, I love you guys. I'm like, my like anxieties are really high right now, so I definitely need to do a was it VF? Oh yeah, it was VF who told me this. Oh yeah, good. Blame VF. Just kidding. Yeah, so I just wanted to, oh god, I don't know. All right, we're gonna come back. I'm gonna come back and hang out with me because I'm like my anxiety's at like a fucking 100. All right, we'll be back. Love you guys.